Very good. Let's get started. So first, I want to say thank you for everyone for attending this ABC webinar. I look forward to talking with all of you about the resource kits that the ABC has developed. First, I wanted to go over a couple of housekeeping items before we get started. Everyone but our speakers are muted for the beginning of our call, but after we go through some details about the resource kits, we will open up the line for our Q&A section. In the meantime, though, throughout the presentation, please feel free to type any questions into the chat box in WebEx, and we will be able to address them during the end of our call. Also, we will be recording this webinar and sharing it on the ABC website. That's abcardio.org to make this information available to those interested parties who cannot join us today. So, moving forward, we are very happy to have one of the leaders of this initiative join us today. Dr. Duncan, could you say a couple of words about yourself and lead us through a couple of the introductory slides?
Absolutely. Thanks, Eric. My name is Dr. Phil Duncan, and I'm happy to be here today to talk about the resource kit. I'm a cardiologist, general cardiologist, medical director at Cardiac Health Management in Richmond, Virginia. And just want to talk a little bit about the purpose of the webinar, and it's just to give everyone some background on our Access to Care initiatives, to talk about the access and the use of our unique resources, and to address any open questions you may have about the resource kit. As an overview of there we go, there's our agenda. As an overview of our agenda, I just want to provide a few opening remarks on ABC, and then Eric will talk about the download of the kit and the use of the resource kit. I'm filling in here for Cassandra, who to this point has been unable to make the call. So before we do that, I just want to talk a little bit about or thank our sponsors in this initiative. This has been a group effort, and this is a list of our sponsors, so we give them our greatest appreciation. And now let's move on, and before I talk about the resource kit, let's move on and get some background on ABC. So ABC has been an active organization for over 40 years. It's been and has international membership consisting of health professionals, community health advocates, and corporate members. The mission of ABC is to promote the prevention of cardiovascular disease in Blacks and other minorities by eliminating healthcare disparities. And in this initiative, we've been grateful to our partners and a range of individuals and organizations to focus on the topic of access to health care. In regards to resource kit, we understand that the prior auth landscape is constantly changing, but it's one that many ABC members and others in the community that treats cardiovascular disease can find extremely challenging. So with that said, Eric, I'd like to pass to you or have you do some details about the work group and how the resource kits were created.
Certainly. Will do. Thank you for that, Dr. Duncan. I appreciate it. So before we get to some specifics about the resource kit, we will start with the work group. A wide variety of work group members have been involved with the initial research and the development of the resource kits, including here you can see individuals from organizations that represented nursing, physician groups, patient advocacy organizations, and other healthcare stakeholders. And one consistent theme that you might see throughout this webinar is that we were focused on building these resource kits through a collaborative thought process. So taking a step back and asking why are we focused on access here, it's because although treatment options have been advancing, access does remain a challenge, especially for the underserved and minority patients. A little bit more detail on access here. Rather recently, a study among physicians who treat a high proportion of underserved and minority patients showed that there are challenges among getting CBD therapies approved, which implies that access can be a barrier to treatment among the underserved and the minority populations. As shown here, for 3 of the newer CBD therapies in particular, approximately 1 in 3 cardiologists or more say that they are encountering challenges with the prior authorization process. So why does that lead us to focus on PA? There's a variety of information to point to as to why prior auth is a big part of the denials that lead to some of the access challenges. First, we have information from the joint ABC-ACC survey that shows us that the prior auth burden is not really slowing down. Over 3/4 of physicians say that the PA burden has increased over the last 5 years. Additionally, we know that almost half of cardiologists do not have sufficient resources in place to manage PBM documentation. Also, we know that it's critical that we collectively begin to look at this issue, and that's because cardiologists believe that continued barriers here can lead to disparities of care and other barriers to patient care. The underserved and the minority patient will be particularly impacted, and that's why it's important that for practices that we focus on making sure that they have the right tools available to help them navigate the prior auth process. So the resource kits are one of 3 ongoing programs, and one of 2 that are specifically focused on prior auth challenges in particular. There's a robust overall effort to address major issues such as access that are impacting the underserved and minority patient populations. So now that we've covered a bit of background on the ABC and how the resource kits were created, I want to talk about some of the unique benefits that the resource kits have to offer and how they can be accessed. I would also like to talk about how to share these resource kits throughout your network and how they can help support CBD prescribers and others in their practice. Overall, these resource kits have been available and live for about a month now, and the ABC and its partners have been sharing this information at conferences and throughout other communication channels as well. So the focus of the resource kits, as Dr. Duncan had alluded to in the beginning, are to help healthcare providers better respond to the prior auth process, especially for the underserved and minority patients. The kits are not designed to change the current prior auth system, but rather to help providers and their patients better respond to specific prior authorization barriers for certain commonly used CBD medications. The Access to Care initiative is looking at more long-term ways to understand and how to optimize the prior auth process, but the resource kits are an effort focused on the healthcare system today. So I want to take a second and just go over the layout for these resource kits. One key attribute of these resource kits is that they are optimized to be used on a provider's mobile phone or on their computer. And this will allow any prescriber or HCP to make PA support tools available at their fingertips when they need it. This will allow you to easily search for specific information or navigate to a certain section to capture the most appropriate information for your situation. Similar to how the Access to Care initiative began, the resource kits were created through a collaborative process which involved a variety of different experts and healthcare stakeholders. As you can see in the middle, the kits currently target 3 specific disease states based on the 2 most recent surveys that were conducted by the ABC along with the ACC. And the resource kits, of course, can be downloaded and used by anyone that's involved with the prior authorization process, but specifically it was designed for the physician, the nurse, or the other healthcare professional that's involved with the prior auth process. So I'd like to walk through some specific parts of the resource kit. If you'd like to follow along on a live version, please navigate to the link shown above, abcardio.org/resource-kits. That link is also available if you are joining live on this webinar in the description box. So as I had mentioned previously, we have 3 different resource kits that are available to download with relevant information to those 3 specific disease areas. So one is focused on lipid disorders. That would be the PCSK9 inhibitors. One is focused on stroke, or the DOACs, and the other on heart failure, or ARNI therapy. One important thing to note, as part of our process, we made sure that each of these resource kits, as they were being drafted, was tested in the field with diverse physician practices to ensure that they are effective and that they are providing real helpful information. And these resource kits are different from others that you may have seen or may have used because they focus on the underserved and minority patient population, and they offer new proprietary insights from those such as cardiologists, payers, and other prior authorization experts. So let's go through some key examples, just a few, of what's included in these resource kits. So here we have our content. The resource kits cover all the different phases of the prior auth process, along with tools and resources that can be easily printed or downloaded. Specifically, the resource kits cover what's involved and what's sometimes missed when submitting a prior authorization request, how to deal with those prior authorization denials, and how to submit an appeal. Also, quick summary lists pull out the most important information for the healthcare professional. This information has been organized for each disease state specifically and is intended to provide a quick reference checklist of items to either double check or confirm as you move through the prior authorization process. Tips are also available as a quick reminder on some specific prior authorization tasks, and some of our initial research that we've performed in the testing phase shows that these tips have been helpful for other healthcare professionals responsible for completing the prior authorization requests. Additionally, the work group that supported this initiative has performed a lot of research to identify a variety of tools and resources that can be helpful. And they have summarized these disease state-specific resources here in the tool section with quick links that you can scroll to and access easily depending on your unique situation. So we encourage you to share these unique resource kits in order to provide helpful tools to any provider working with underserved or minority patients and who may be looking to prescribe newer CBD medications. We look forward to hearing your feedback on how impactful the resource kits are with a follow-up survey. So now I would like to unmute the line if there are any questions. And if not, I'd like to look to my colleague Sarah, who has been capturing questions that may be coming through throughout the webinar in the chat box, and she can direct those questions accordingly. Okay, I have unmuted the line, but it doesn't sound like anyone on the line has any specific questions. Sarah, would you be able to see if anybody typed in any questions throughout the webinar?
Yeah, sure, Eric, and good evening to everyone on the webinar. We have actually gotten a couple of questions through the chat. The first one, I think, is something that either you or Dr. Duncan may be able to weigh in on, and that is a question about how to access the kits. It was noted that these are easily accessible and maybe can be downloaded. Would that include both a cell phone as well as another mobile device?
I'll deal that one, Eric. It can be accessed via that ABC or abcardio.org/resource kits. If you go to the site, you can also find it's a little bit more challenging, but you can find it through the site. But once you get there, it's easy to download the kits. You know, I've downloaded them they're in PDF format, and I've downloaded them and put them on our shared drive in the office, as well as it's on my own OneDrive. So I've got it on my phone and laptop and pad and home computer. So they're really easy to use and download.
Perfect, great, thank you. I think that's very helpful. And there's actually another question, again, about accessibility. And that is, somebody is asking, do you have to be an ABC member to use the resource kit?
Well, absolutely not. Anyone, any healthcare provider or their office staff can download the kit and utilize it.
Excellent, thank you. And then changing gears, I think, a little bit to this next question, which also just came through via the chat. And this is a question about more the creation or the genesis behind the kits. And this individual asks, you noted that the kits were focused on the underserved. Can you provide some specific examples or details of that? So I don't know, Eric, that might be a question for you.
Certainly, I'd be happy to talk more about that. Well, we do know that a lot of the data that we had looked at and that we evaluated, whether it comes to specific published literature or the ABC-ACC survey, that data that we evaluated was always looking at the underserved or the minority patient. And that was also true in the conversations that we had, whether we were talking to an expert cardiologist or physician that's had a lot of experience navigating the prior authorization process. We always had the underserved or minority patient in mind, and making sure that we're capturing tidbits of information or tools and other resources that a physician or their staff could use in assisting those practices that are focused in those areas. you have anything else to add from that perspective, Dr. Duncan?
Yes. One of the things that we recognize is that if a patient is taken care of in a setting where there aren't enough human resources to manage the laborious PA process, that's where some of these newer agents, very effective agents, are underutilized. So essentially, this is more an issue of not the disease process being different, but looking at patients who are being taken care of in settings where resources to focus on PA are limited, to streamline that process so all patients get the best therapy, not just those in the settings that are more heavily resourced.
Excellent, thank you. And I think that about wraps up the questions that we've received through the chat. I guess we'll close, if I may, by just asking a question from my end, which is, I know the prior slide did note that, that these kits are available now and can also be shared by anyone on this, listening to this webinar, or who find their way to the kits in the other fashion. You also noted that there's a survey collecting follow-up information. Can you talk a little bit about what that survey data is going to be used for?
Certainly. I'd be happy to do so, Sarah. So although the kits, when we had initially created them, they did go through the initial testing process with a diverse set of practice settings, we do want to make sure that these are living documents. So for those that do register to download the kits, you'll see we do ask for a name and email address. And we'd like to follow up with a sample size of those that have downloaded the resource kits to understand if there are any new tools or resources that we can include, or any changes that we can make to make sure that these resource kits stay useful and helpful for the physicians and their staff.
Very good, thank you.
Okay, so I think we've captured a lot of the questions. I'm going to move forward and just provide another thank you. Take a moment to acknowledge the sponsors whose unrestricted support has made today's event possible, along with the overall ABC Access to Care initiative. And to summarize the action steps here, some of the things that you can do with the resource kits. The ABC encourages you to download these kits and share them throughout your network. The link is provided here, but we also want to make sure you have this at your fingertips. So at 7:45 p.m. Eastern Time, just after this call, you will receive a follow-up thank you email from WebEx, and that will have that specific link, so you could feel free to forward that throughout your network as you feel appropriate. And for those that would like a bit more background, this recorded webinar will be posted to the ABC website, and you can direct your colleagues here to take a look if they are interested. Also, we look forward to hearing feedback from you and from your colleagues about how helpful the resource kits are, and if they have any recommendations on how we can make improvements. And additionally, there is a lot of ongoing work related to the Access to Care initiative. Please feel free to keep updated by checking the ABC website at abcardio.org. Thank you all for joining this Resource Kit webinar today, and have a great rest of your day.
Thank you, everyone. Thank you, Eric.
Thank you.